Morning, everyone. This is Stephen Gockley, co-chair of the Incarceration Prevention and Reduction Task Force and the Law and Justice Council. We're convening for our November meeting. We do not yet have a quorum, but we'll proceed with some informational items. The first item is the land acknowledgement statement, which I will deliver. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that brought us together here today. And please join us in uncovering such truths at any and all public events. Unfortunately, my co-chair, Jack Hovenier, has health issues that keep him from participating in this morning's meeting. As you know, Jack often can see the attendees, can see hands raised, and can do a lot of the coordination of our discussion from his position. I don't have those capabilities, so I'm going to be relying on Jill Nixon, our staff person, to do those. So you'll hear a little bit more from Jill this meeting than sometimes you do. Does anybody have anything they want to add to the agenda before we start out? Okay. First item on the agenda involves committee updates. Let's start with Behavioral Health Committee. Dan, are you on tap for that?
Yes. Can you hear me? Can you hear me okay?
Yeah.
Okay. Great. I'll just recap the October 6th, 2020 Behavioral Health subcommittee meeting. We had a few items that we covered. The first one was a briefing on children's initiatives. Heather Flaherty, who has been a really excellent leader on this issue, gave a presentation on the work being done in the community on children's initiatives. We discussed creating an office of family and well-being. We talked about specific needs and programs and interventions that help people avert criminal justice systems. We've had these discussions in various incarnations on this task force for, I don't know, probably 3 years. And we're really drilling into some of the specifics on how we can get to preventing some of these early social determinants of health as they relate to later to criminogenic behavior. So we're really kind of trying to keep it focused here on within the confines of the work plan for the task force. So we did look at some root causes of what causes juveniles to end up in detention. Talked about endorsing and participating in a children's initiative work. The committee continued to discuss children's health insurance program, behavioral health services for kids and families, helping to end child homelessness, and resources like Dispute Resolution Center, some of the programs that they have over there, really excellent work there. Also, whether to maintain school resource officers or to create non-police school resource officers, and perhaps adding a youth specialist to the mobile crisis outreach team. Heather, did I miss any key items there?
No, thank you, Councilmember Hamill. That was a perfect summary.
Oh, okay, thanks. We want to expand, thanks Heather, we wanted to expand our committee representation, and Heather and Megan Ballou are leading the charge on that item, and we'll provide an update at another meeting coming up. We talked about expanding our communication efforts. I really believe that we need, as government and as in law enforcement, fire, first responders, we need to be really clear and transparent with the efforts that we're making, so our community understands the work that's going into all of these excellent efforts. And so We had talked about setting up a forum once or twice a year that could be a Zoom forum, a couple times a year, perhaps doing an op-ed piece in the local weekly, the Cascadia Weekly, as well as posts to Facebook, and also reaching out and working with Bellingham Herald to work on kind of update on the things that we're working on here in behavioral health. We had talked with working with Jed he's the county's community outreach facilitator, and working with him on resources to use the full capability of the county's communications efforts. And Mike Hilly and I will work together and we'll develop a plan in the coming months here and report that back to the broader task force. We also discussed the upcoming November 10th joint meeting with legal and justice systems. And we have a lot of questions and a lot of items we want to cover, including DWLS third. That's not a standalone charge anymore. We want to understand the repercussions of that, what that looks like. Same for VOXA, the violation of Uniform Controlled Substance Act, going to misdemeanor from felony. Continuances, the SOC stipulation of continuance, and what that means for folks, if are they successful or not, and what does that mean and what does that look like? We wanted to get an update on drug court and mental health court, including housing and gaps in the system. There's a lot of questions about how LEAD will work with courts and how it will integrate with the GRACE program. So we're hoping to hear from Prosecutor Ritchie and other experts. We wanted to get more of an update on Crisis Stabilization Center and how it will work with the programs and the process for involuntary commitment. We were focusing on data on race disparity in the jail, particularly Native American, and specifically how Lummi Nation makes arrests, and information on the racial makeup of the folks that other agencies are booking into the jail, and the need for data to inform policy discussion and decisions. And that's pretty much the recap. I don't know, Mike Parker, if you, as co-chair, if you have any other things you wanted to add in there.
No, Dan, I think you covered 100% of it. It was jam-packed, and I think we had to move an item to the following month. Actually, it was so full. So no, you've covered it all. Thanks. Okay.
Thanks, folks. And I'm gonna have to jump off this meeting in a bit here to move to a different city to get onto a different call with the budget folks from the city council. So I'll be jumping off at some point, but I'm gonna listen in as long as I can.
Dan, one question.
Yeah.
When is the next behavioral health committee meeting?
Jill, do you have that date? I don't have it in front of me.
The joint meeting is November 10th.
Oh, yeah, sorry, Mayor. Yeah, joint's November 10th. I don't know when the one after that is though.
One after that is December 15th.
And Jill, can we get the time for the November 10th?
11:30 a.m.
Okay.
Thank you.
Anybody is not on the usual invitation list for that joint meeting and would like to be, just email Jill and she can get you the link.
Thanks.
Okay.
Any other questions for Dan or Mike? Okay, thanks guys. A lot of good work there.
Thank you.
I didn't see Jill or Arlene and or Raylene on to report on legal and justice systems.
I see Arlene right there.
Good. Arlene, you want to start out?
Arlene, I think you're muted.
Can you hear me now?
Yes.
Now we can hear you.
Thank you.
Okay, good. The meeting was held October 13th, and the first presentation was from Mike Parker on the GARE program. So we had a lively discussion about those issues. But the most important piece to that meeting, I think, was the fact that our county is trying its best to expand our social services, on our mental health and addiction services to catch all the problems that we're trying to catch. And we essentially have to maintain our reentry program. But the managed care organizations are essentially saying they're not going to support these programs. This is very, very important what I'm talking about, because they hold a great deal of power as far as funding services is concerned. And the only organization that has influence with the MCOs up to now is the healthcare state program, which has granted them the power to decide all these things and to take care of all the insurance issues. So this is terribly important. We need funding for reentry program and expanding the reentry program that we have had in the past. And especially funding is going to be needed for the expansion in the crisis stabilization program. This is terribly important. We can't do what we want to do if we don't have the funding to back it. So in a way, I'm throwing this out to all of you who have connections through the state and the county to try to help us think of ways to influence the managed care organizations to do their job. It is their responsibility to provide for services, but at the same time, they are refusing to do that. We talked about the 24/7 facility and the fact that law enforcement and Compass Health, they need a place to put people, to hold people. Up to now, the only holds that are going to be allowed are a 12-hour for the police. But we need many more kinds of holds than that, because there are many more kinds of situations that occur that the police have to deal with. And so it's not sufficient. But we have to have the money in order to go forward with that. So that was the essence of it. Any questions? Dan.
This is Anne.
Oh, hi, Anne.
Oh, Dan, you go ahead in case you have to leave.
I'm just wondering if there are specific asks that you all came up with that we can ask our state reps to do that would help influence the MCOs.
Anne, would you like to respond to him?
Sure. I think, so just to clarify something, the Healthcare Authority holds the contracts with the managed care organizations. And part of the contractual obligations is to provide reentry services. So the issue is how it's done. And that's where the MCOs are hoping that they can do much of it remotely, which of course will be interesting and probably not very effective. And I think, so we have had some discussions with the MCOs about how they're going to do that. I think they have come to the realization as of last week with another meeting that perhaps they're going to have to pay some amount to the counties to facilitate their ability to provide some of these reentry services for the population that they serve, which is people on Medicaid. So it is a work in progress. I would say within the month, we'll probably have a pretty clear sense of where we need to go and whether or not a legislative fix is needed. My guess is that because it's a contractual issue, that I think our pressure is probably going to be more effective placed on the state agency as opposed to the legislation fix. But those conversations are active right now, trying to make sure that, first of all, I think, to be honest with you, I think the MCOs were hoping that the counties would just step up and provide some services to include identification of which of their enrolled members have been booked into the jail. And we were very clear, we're not doing any of your work on your behalf without compensation. And they did not want to compensate. As of last week, they started to realize that maybe they're going to have to. So it's baby steps, but I don't know that we have a specific ask quite yet because we're still negotiating.
I mean, for me, the issue is what we've had in the past was not sufficient. It was good. The programs that we've seen reported to us sounded really excellent, but they were never enough. And so if we leave it to them, they'll pay the least amount that they possibly can, and we'll get the most meager amount of services to dribble out. When this is a terribly, for example, reentry is terribly important as far as reoffending is concerned.
And I think for those of us who participated in the Policy Academy a year ago, Roger Goodman, who is a state representative out of, I believe, the 44th district, don't quote me on that one, was and still is the leader of kind of the criminal justice efforts at the state legislative body. And I think as we move forward, it would probably be helpful for us to touch base with him.
He's an amazing legislator, and he's terribly interested in the issues that we're concerned about. So he would be a really good support.
Yeah, and he's aware somewhat of what we've been doing in Whatcom County because he participated with us in a 3-day meeting in Philadelphia. So it wouldn't take long to get him up to speed.
And this is Stephen. You emphasized that the MCOs, the managed care organizations, cover services to Medicaid recipients. So they do not for those who do not qualify for Medicaid. And I'm wondering if you can clarify what portion of the people discharged from the jail, and I guess this would apply also to the crisis stabilization facility, would be non-Medicaid people, and how that factors into all of these equations.
So I don't have the recent stats, and I will find the report from the state of Washington, the Washington State Institute for Public Policy, but they did do some research on that about people in jail who are Medicaid covered and have serious behavioral health issues. And I would say it was a very, very high percentage. And I don't really want to quote you, but it's well above 50% that are Medicaid. Now, obviously their Medicaid coverage doesn't, it's not in effect while they are incarcerated, but the MCOs are still responsible for taking care of those people upon release and obviously coordinating any medical behavioral health care while they're in jail. The Crisis Stabilization Center, for instance, has been operating where maybe, and again, a much smaller percent, maybe 30% are non-Medicaid, perhaps, maybe 20. So, but I will say that we do have some funds given to us from a state legislative proviso, us meaning the county health department, that we put out in contract for reentry services for those people. So we are providing reentry services, but it funds about a half-time position. And we need a full-time position at least in that role.
Thank you.
This is Scott Cortice. This is new to me. So the MCO, a managed care organization, what else do they fund, or what is tapping into their budget that this request is? I mean, are they doing a lot of other things, or is this a piece of what they do, or what else do they do?
So they now, as of within the last year and a half, they became 5 different health insurance plans, became the administrator for all Medicaid services in the county. So every person on Medicaid is enrolled in one of those 5 plans, and that's health care, behavioral health care, substance use disorder care, any kind of service that belongs under that. And they are paid by the state on a per member per month basis, basically. So it's not what they're paying for or not, but I think it's part of their business plan. Their business plan is that they don't want to contract out for services that they believe they should be providing. So reentry services, I think they want to provide them themselves, according to our discussions with them. But when you have a smaller jail like Whatcom, that means they might come in once or twice a month. And yet, if our average stay is maybe 11 days, or more commonly, maybe 3 days, that's really not going to be effective. So they're trying to grapple with how do they align their business model with the actual needs and services. So I think for them, it's still a learning experience.
Thank you.
Any other questions for Ann or for Arlene on legal and justice systems?
Stephen, this is Jill.
Yes.
I just want to let you know there is a quorum right now. And I don't know how long that will last. And there's one item on today's agenda that is up for a vote.
Okay. Yeah, Dan will have to leave. If Dan leaves, will that lose our quorum?
No, we should be good still.
Okay.
I might add that I probably will have to leave early. We have an unexpected meeting this afternoon that's compelling that I have to miss, and apologize for signing in late. They upgraded my computer and I was unable to get in. So thank you.
That's not a problem, Sheriff. How long do we have you?
I should be available till about 10:20.
Okay. So our decision-making item is after the committee reports. So if it makes sense to everybody, I'll just have Barry report for the steering committee and then we'll move on to that.
Yeah, I'm going to be real quick, Stephen, because most of our substantive issues are on our agenda today.
Okay.
Two of the things that we talked about the most in the last couple months is crisis response models, to how we might enhance that. And Ann is going to give us a presentation a little later in this meeting. And the other one is our racial equity toolkit, which Mike Parker is going to give us a presentation on next. So two of our most substantial issues are going to be covered today. Really, the other things that we've been dealing with are more housekeeping in nature, setting up our schedule of meetings, since now we voted to go to once a month. We took a look at our next year schedule. We're going to start our first meeting in 2021 will be on January 4th. And that's really the brunt of what happened. I think we're going to be able to flesh these subjects out a lot better in the next two items as we go forward in today's meeting. So that's really all I wanted to say, Stephen, is just to kind of queue up those two items.
Okay. Thank you, Barry. Any questions for Barry? Very well.
Stephen?
Yes.
Seth here. I have, I think I may be in the same meeting that Sheriff Elfos needs to go to. So my window is limited as well. Just wanted to pass that on for finding a time to vote purposes.
Thank you very much.
Mm-hmm.
Well, let's move on to that. The next item on the agenda is the GARE Racial Equity Toolkit. Mike, I guess you're taking the lead on this, and thank you for doing that.
You bet. Thank you again for having me. And hopefully we're not looking at this as a dead horse. This is probably one of the most important topics I've been talking about. But I know I've been talking to this group a lot and in various different settings. So I apologize for hearing this again. Again, I just want to note that while I may not be the best person to bring this, you get me. I'm enthusiastic. If there are people in the room that can speak to this better, please do at any point. And I'm really okay to be interrupted in that. So again, thank you for bearing with me. Since we met the last time, I've been able to meet with two other groups. So Legal and Justice, we had a really good conversation there. And also Mayor Cortice invited me to his group with the other small city mayors in the Small Cities Caucus. And very briefly, before I share the contents of those, of the examples, I wanted to just talk very briefly of just a recap So the toolkit essentially, right, is part of, could be a tool for this incarceration task force to wrestle with and to handle questions of racial equity in things that we bring forth. And a couple of really interesting questions came out that I thought might be useful in my recap to you all, because then you could get the benefit of the questions. So one of them was, and I would say that overwhelmingly, by the way, the response is very positive. I don't sense a lot of discomfort doing this. I sensed a lot of interest in what is it and what are we signing on and wanting to do it authentically. So I just want to state that I really took the questions that people had as really wanting to understand it. So one of the questions that came out to share with you all, which was a really great question. Are we deciding on something? Are we recommending for the whole county or are we recommending for a task force? And that is a great question. And we really should have been more clear. What we're advocating for today and what you'll be voting on today is for the work of the task force and its subcommittees. So that was a great question. It was a really important piece of clarification. Should Whatcom County have a racial equity office? Obviously, we could interact with that office, but this does not supplant that. And we're not, in this, what you're voting on is not to make that happen. So that was a really good question. Another question that came out of Mayor Cortiz's forum, which was a really good one, is, well, how are you going to implement? Who does it? And does it cost money? Are you going to be adding expenses? We're in a tight budget situation. I thought it was a great question. Mayor Cortiz, I don't remember who asked it, but it was a great question. And no, this does not take additional staff. Actually, it's us. It is us, the people on the task force, the people that chair it, the people as participate. We're the ones that are going to implement this toolkit. So I thought that was a great question, and we're not asking for staff time, but we are asking for our own time and our own dedication and our will to continue to employ a toolkit. There was another one is that Chief Dahl asked, which was a really good idea too, is, this seems somewhat abstract to have 6 questions that we're applying to every decision that we make or recommendations that we make. Are there some examples, Mike, that we might be able to share? So thank you, Chief Dahl, for that question. It was a really good question. And I'm going to go ahead and just briefly share my screen. So you've been given links to both of these documents. Let's see if I can find it. Share. All right, hopefully you all can see that. Okay. So one of the first examples, so I did come up with 2 different examples, and there are quite a few, many more on the GARE website. But the first one happened in the city of San Francisco, which has been a GARE member for some time. And in San Francisco, they've been employing racial equity tools and toolkits also for some time. This woman's name, Ann Studerer, I probably messed that pronunciation up. She's the Financial Justice Project Director in the city of San Francisco. And this example that you have in front of you is a fascinating one. So what they did is they looked at their system of fines and the way that they fund their criminal justice system and looked at that from an equity perspective and realized they were really getting a lot of the funds for that system from people who were people of color, were people in poverty, and it was actually hurting their ability to re-enter into society and to make a clean start. So for a city of San Francisco, using that racial equity lens and that framework from GARE, they kind of are attacking this. Now that's a process. They didn't just suddenly get rid of all fines. They have to go down that process. But Chief Dahl asked a really good question. Well, what kind of things can people do with this? Well, I think you can look at a system, look at who is being disparately impacted or negatively impacted and say, do we have to do it that way? Can we do it another way? So that was one example that I wanted to share with you all. Another one, if you will, is a little bit closer to home in the city of Tacoma. So in the city of Tacoma, they have a senior policy analyst, Allison Beeson, who's been doing equity work for quite some time. They did a little different, and this is a little less criminal justice, but thought it was a really good example. And thanks to Stephen and Barry, who kind of took a look at some of these examples for me. What they did in Tacoma is they used racial equity and they used it with their ArcGIS system. So when it came down to maybe let's say deploying some new streetlights and they only had enough for 5 and they're trying to figure out where from an equity perspective, where makes the most sense? Well, they were able to use their ArcGIS data, which is essentially geographical data, right? Looking at neighborhoods, maybe where there were trouble spots or where there were break-ins, and could add streetlights, for example. So their racial equity process kind of took a geographical spin, and they looked at making neighborhood and system-wide improvements based on racial equity data that they got. So this kind of wraps the last question, which was Chief Stahl's question, like how are entities using this, and how might our entity use this? And obviously we grapple with questions. Ours are squarely in criminal justice, but you can see some, hopefully some similar corollaries. With that, I don't want to go on for a long time. I think I wanted to recap kind of the questions that have come up, some of the good conversation, and give this group a few examples. And again, I think Jill included these in your packet. And at this point, please let me know if there are any questions.
Okay. Thank you very much, Mike. That helped. Barry from steering, is there anything you want to add to Mike's presentation?
No, I don't think so. I think that covered it really well. I think our next phase is that we would talk about adopting this as policy for the Incarceration Prevention Task Force. So I shall move adoption of the GARE toolkit for the task force.
Second.
So it's moved and seconded. And if you'll recall, I believe we had a motion and a second last month. We tabled the motion. Mayor Cortice wanted to consult with small cities.
That's right.
And Scott, I just wonder if there's anything you want to report on that discussion with Mike and your colleagues.
Yeah, it was a really good meeting. Mike's thanks for coming to that, and he provided good insight to the group. I guess the mayors of the smaller cities feel like, I don't know, a variety of things. Like maybe it's the flavor of the day, maybe it's a bit of overreach. And they really, I mean, he answered the question. It's not for our cities or the other governments, for this group. And it might work for this group, but they were uncomfortable with me saying, if they were uncomfortable doing it in their own cities, they're uncomfortable me saying I should support it here. So I'll probably vote no, even though it probably won't matter.
Okay. Is there any other discussion on the motion? All right. Scott, thank you for following through on that. I'll call the question and ask that all the task force members in favor of adopting the GARE Racial Equity Toolkit for use throughout the task force and its subcommittees, say aye.
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 Anyone opposed?
Aye.
Any abstention? All right, thank you, everyone. That motion is carried. I appreciate the discussion, the deliberation, and the care that went into making that decision. Mike, I want to just commend you again for your leadership and diligence in working with the group to allow us to understand this and adopt it. And for all the chair people, I look forward to your implementation of this process, and this probably is something that we'll look for feedback on how things are going, or best practices, pitfalls that you run into as you run through the racial equity process.
Stephen, I just want to thank the group for giving me the latitude to talk to the other small city mayors, and appreciate giving me that extra time, and thank you for that very much.
Absolutely, yeah. Okay, next item on the agenda. And by the way, for Dan and Bill and Seth, I think that was the only decisional item on the agenda, and so you are free anytime you need to drop off the call. The next item on the agenda is behavioral health crisis response expansion. Anne, you are on to present that. I'll note in your task force packet, there is a one-page summary that Anne had created for us.
Sure. This is in response to both Bellingham City Council and Whatcom County Council and our other executives to look at ways that we can expand and enhance our response to people who are experiencing a behavioral health crisis, and to the extent possible, reduce maybe unnecessary law enforcement responses to those and increase the unarmed response. So there were 3 goals listed in that packet, and obviously one of them is improving the outcomes for people who are experiencing behavioral health crises. So the health department, Human Services Division, has volunteered to facilitate and provide the leadership to these discussions, and to, first of all, clearly identify the problems and the shortcomings, and then also identify what resources do we currently have that we might be able to build upon, as opposed to creating maybe a totally separate standalone program, which at this point doesn't look like it's necessary. We have a number of different resources currently in operation in our community that we could build upon. So I created this just as really an outline to help people understand what our general process is going to be. We're going to work very closely with the Grace Management team, since those are the folks that are doing a lot of this work already in different ways, but certainly have the expertise in that core group to help facilitate. So our process is really going to be to gather the data we need so that we can not only identify the populations that we intend to serve. Obviously, we understand that there are some people, even if they're experiencing a behavioral health crisis, where law enforcement is still going to be the most appropriate response just for safety reasons alone. But we also know there's a number of people, 911 calls that occur from people in behavioral health crisis where safety, violence, concerns like that are really not a part of it, and that maybe we can use the data we collect to really get a much better picture of where might we be able to intervene and provide additional services. So data collection is where we've started our work, and obviously working with the 911, the WATCOM system, and also we'll be working with our current non-civilian crisis response teams. And I do want to say that we already have civilian unarmed responses to people in behavioral health crisis. Right now, over the last 12 months, they have averaged about 188 dispatches a month. And we believe there is the ability to expand that number and, maybe broaden the services. So obviously, we'll be looking very closely at working with that team or those sets of teams to do that work. We also know that there are a number of programs around the nation that are providing multi-system responses or multi-professional responses to include social workers, maybe community paramedics, nurses, et cetera. There's a number of different models. So part of our work will also be to research the models, their outcomes, determine what are some common elements and things that we find through all these models that build successful programs. And that's really how we help set our guideposts, if you will, on where do we need to be moving our efforts. And then obviously all of this, we are a mid-sized county. And so we always have to look at the cost versus the return on investment. We know of the program Cahoots, for instance, that everybody's talking about across the nation right now in Eugene. Last I heard, it was like over a $4 million a year program. The question for us is that the best return on our investment, or can we make modifications or build on current programs and services to create a model that would provide similar outcomes, but maybe not at that very high cost? So lots of different things that we have to look at to make sure that we're not only responsible from a financial standpoint, but that we're really making sure that we're addressing the problems that we've identified. In number 5 here, I really listed these out just so people in the community and our elected officials understand all the different programs currently in place. This is going to be really important to look at when we're trying to decide how do we expand, what programs might we be able to build upon, and if so, how would we do that? And part of that is creating bridges between systems. Part of it is creating, through those bridges, integrated, coordinated system of response. That's what we did with GRACE. And with GRACE, it was a hub and spoke model where GRACE was the hub, but the spokes were actually all of these different programs listed, so that we really could create a system that was coordinated and collaborative, and that we could also support one another in the various tasks that are provided by each of those programs. So our plan right now is to give a presentation to Bellingham City Council in November, as well as to give one to County Council to provide an overview of our process going forward. We're starting to build a Gantt chart that will give us tasks and timelines so people will be kept up to date in terms of where we are in our planning process. And obviously part of this will be drawing in experts from different areas to either provide data, whether it's quantitative data or qualitative data, making sure that we do interviews, maybe do ride-alongs with law enforcement to make sure we understand what it's like on the ground, and then just continue to engage those stakeholders so that we know then what might this cost us and what other potential funders might we want to engage in who help support these efforts. The biggest thing for us is just to make sure that we don't duplicate efforts and that we don't set up just a brand new standalone program not connected to anything, that we really want to bring as much coordination and integration as possible so that we can optimize and maximize our resources, and then hopefully also optimize the outcomes we're looking for. Once we get there, then it's all about identifying what entity is going to actually provide these services. And if we're building on current systems, it might be a number of providers linked to some core hub or some other alternate option for that. So that's where we are right now. And I'll take questions or thoughts or brilliant ideas.
And I've got a question for you. Do you see any possibilities of cost savings in a model that you're talking about, or is that just not going to happen?
I think it's difficult, first of all, to determine costs that you prevent. So we do a number of prevention programs that are evidence-based, but those are usually proven to be effective on a federal level where they have lots, hundreds of thousands of dollars to do those research projects and determine the savings, so that we know if we follow that model through by fidelity that we will save X number of dollars. We probably will never be we won't get there exactly, simply because we don't have thousands and thousands of dollars for that kind of research. But historically, we know that a day in jail is much cheaper than a day in a treatment facility. That's just money, right? But that's not all we look at when we look at cost savings. We also look at the cost to human life and people's well-being, as well as their livelihoods. So I think in part of this process, we're probably going to have to, part of that cost versus return on investment, we're going to have to look at, what are the costs that we don't typically take into account? Because it's not just money.
I think just I'm just speaking for myself here, but I do think I agree with you that we do need to look at those broader savings, and it's not just system costs. I think it's what is the cost on domestic violence? what's the cost on child abuse or further drug addiction or whatever the case may be. Those are costs that we may never be able to quantify. But I think it's I feel it's like my responsibility or our responsibility to identify those savings, because it is people's lives. And I think that that's really, at the end of the day, that's what we're here for. So if there's a way to come up with a formula or to maybe track categories or whatever the best way to do that, I'd like to see that as part of the part of this program.
Good feedback.
And I appreciate the thoughtful approach that we're taking on this. I also believe that safety should always be our #1 priority, especially for the people that we're sending out to assist those who are in crisis. One of the things I always say is that you can't de-escalate an uncooperative individual, and we'll spice it up and say you can't de-escalate someone who doesn't have the mental capacity to be de-escalated, and that's the absolute truth. And so the safety part of this is huge for me. At the risk of your 1-page handout becoming 2 pages, I would suggest that you spell out the acronyms, especially if the community is going to look at this document when we give it to council, because there's some really important programs that we're going to be talking about that need to be spelled out. But I'm excited about this. I think it's, looking at some of the data right now, I think there are some calls that, we'll identify that are safe to send people who can help others. And I'm looking forward to participating in this process with you.
Great. And I think maybe we'll put a second page, which is almost like your glossary. We'll create a glossary, because you're right. Some of those programs are pretty impressive that are listed.
Yeah, I think when we do our presentations, I think it would be good to talk a little bit about that current civilian response that's happening. Maybe highlight a little bit about what that looks like and what that means for our community right now.
Will do.
Arlene, you had a question?
I hope that David and Ann will forgive me for saying this, but I do not approve and appreciate this careful response. I don't. And that is because we do not need to reinvent the wheel here. All across this country, people have programs in their cities that are taking care of their citizens. And we know what they are. The research actually has been done. And it's a matter of choosing what kind of approach that you want to take. The way that you're describing this process, to me, feels like we're stuck in the mud, and we're going to be stuck in the mud for another 2 years. And I have a sense that these changes need to be done more quickly. And it's not an argument about whether or not law enforcement is needed. Of course, law enforcement is needed. They're needed very much. But we know that most of these situations have to do with mental health and addiction. We don't have to research that.
If I can respond, Arlene, we used a process similar to this with Grace, and we never got stuck in the mud. We were always in forward progress, and we actually implemented it in way less than 2 years. And with this, every community is different, and that's what we found in Grace development. We did do the research in terms of the different programs, and that's the research I'm talking about. But what we did is we chose what were the common elements of successful programs, and we built those into the program that we thought best suited our community. And in the last presentation we gave to both city and county council on the Grace program, we took a point in time count of a certain number of individuals in the program and looked at their incarceration and jail rates before grace and then after grace intervention. And there was a 95% improvement in terms of a reduction in criminal justice involvement. So I guess I just want to say that I believe we can move quickly, and I believe that crafting a program that is best suited for our community is going to give us the best outcomes. And we are aware of other programs, and we've already done quite a bit of research, and we've also talked to a number of folks in other parts of the country. So, but I am hesitant to just adopt somebody else's program because their community is not ours.
I mean, it doesn't take a lot to understand that any city would need a central place where anyone and everyone can come for emergency services, where any law enforcement person can bring people that they pick up, and that services are immediately available for the people who are brought in, and that the next step is also available, which is to refer them immediately to whatever services they're going to be needed. This is not, I mean, all of us involved in these programs understand this. We don't have that. Even the expansions that we're talking about for crisis stabilization barely approximate what I'm talking about.
Stephen, Mayor Fleetwood has his hand up.
Oh, thank you. Mayor Fleetwood, question, comment.
Yeah, Ann, could you put the outline back up?
I think Jill put that up. Jill, are you available to do that?
Yeah,
Well, that's all.
one moment to do that here.
That's all right. It's not necessary, but I noticed that it indicated somewhere, I think it's 6C, establish the Crisis Stabilization Center as the hub. Could you just clarify what you mean by as the hub? Is it sort of the whole comprehensive, that will be the central comprehensive location for all things related to behavioral health? I thought that it was a bit more limited than that.
So as the programmatic hub, not necessarily the location hub. So we know that, and this segues from what Arlene was talking about, if we could bring, if law enforcement or first responders has a place to bring people where they might start the process of getting the help they need while they're in treatment or while they're in crisis, then that would be serving as a hub. We've talked about using office space at this center for first responders to complete their reports, to hold collective meetings when they're problem solving an individual's community support plan. And we're also talking about co-locating the or the unarmed response teams as well here. So programmatic hub, not location hub. Okay. Most of the work done is typically out in the field.
All right, thank you. And also under 5I, create a flow chart. Yes. Do you have any sense of when you're hoping that flow chart might be created?
I would think it'd be within the first 2 months. This is typically what we have some now. I just wouldn't use those yet because they're not as comprehensive as I would like. But really trying to get a sense, when we create those maps, it gives us a sense of where are the gaps in service or where are the linkages broken. So that will be one of the first things we do.
In the next several months, it sounds like.
Yes.
Thank you.
And this is Stephen. We're
and
not
Mike,
that, pardon me?
Oh, I was just going to say also Mike Parker has his hand up.
Oh, Mike, why don't you go ahead first?
Okay, thank you. Ann and Arlene, thank you for both of your comments. I think you kind of gave us some ends of the spectrum. And it was something occurred to me as Anne was talking, and she mentioned the term 4 million to implement. And I think what occurred to me was there are certain things that I know to be true, but not everybody does, and not everybody has read that same research. So what I just wanted to share with this task force very briefly is one of the things that we found in housing, and this is work that we've done at Opportunity Council, and really others have been doing the work. We found that it's far cheaper in any way you analyze it, the cost to humans, the cost financially to house people and to care for them, than it is to jail them and to not care for them on the street. And there are multiple studies. And if it would be worthwhile, because while I understand these things and I have read that research, I can see that. And Dan kind of talked a little bit about that. How do we capture the cost savings generated in so many systems? And then, Anne, thank you for bringing that forward and saying, well, we don't necessarily have to do that research in our county. We can follow evidence-based planning. So I just want to remark on this whole piece that just like housing somebody who's homeless is a much more effective way to keep them out of the jail and to keep them out of criminal activity in general, so too will be the way in which we respond to people and possibly diverting them from that justice system. And every ounce of that prevention that you put in there is going to be far more valuable and far more effective. And I think to counter, while it may cost, or maybe, and I think your figure was, maybe it was 4 million to implement Cahoots, but what cost savings did they generate? What cost savings with those number of calls not going to the uniform police response, so that those uniforms could be going to where they really needed? So just so that people have a really holistic view and not look at it as a zero-sum game. We already have this, I have to buy this. Not exactly. You're going to experience cost savings, and there are evidence and there are research and there are reports, real data, not just people like me talking about it, that will be able to demonstrate that cost saving. So I just urge us, as we think about this, thinking about those lives, and I think that it will balance out. And thank you, Anne, for your group in kind of leading us through a possible response. How could we do this Whatcom style? And as a person who participated in some of the GRACE groundwork, that map was seminal. The time spent in the planning was really important. And I think we got a quality product. And I'm really hopeful for this process.
Heather Flaherty has her hand raised.
Heather, go ahead.
Hi, everybody. Just on behalf of the community, one thing, well, of course, I want to say thank you, Anne, and your team for always doing such incredible work and putting a plan together that we can respond to. I'm looking at number 8 and the engaged stakeholders and funders, and I'm recognizing what an important issue this is for the entire community right now, and wondering about the opportunity at the very beginning to engage community members and stakeholders, and to have at least, I think that there was a lot said in the listening sessions that the county exec and mayor had over the summer to build on. And there may be opportunities for more community input throughout this process. And I'm sorry if you already covered that, but I was just thinking that that could be a really great way to involve community members and honor some of the concerns of the community and keep them engaged throughout this planning process.
Thank you, Heather.
And this is Stephen. I'm wondering what you envision the relationship with the task force and this process being. Will we, which I hope at the very minimum, will be able to monitor progress by sort of after the fact reports? Is there any more active involvement you can envision the task force or any particular members of the task force? I know this is an area of widespread focus and concern on our part. I know there are a number of people who would want to engage at the level that Heather just suggested. And thank you, Heather, for calling out that integration with community messaging earlier in the summer. So I don't know, can you just speak to the connection with the task force here?
Well, I've been trying to figure out the best way for that to occur. I think now that we're meeting monthly, to provide a monthly progress report and seek feedback and guidance is a great idea. To be honest, this hits all 4 of our subcommittees, right? The
Right.
Data Index Committee, the Crisis Stabilization Center Committee, as well as Legal Justice and Behavioral Health. So I guess my question would be of you, Stephen, is it better to have these discussions in the whole task force or in each of the committees? And I guess I'm not exactly sure how to do that. In terms of participation in the process, there are many people on the incarceration task force that we're going to be reaching out to participate. But from a formal point of view, I'm not sure what works best.
Okay. Well, we'll look forward to those reaching out invitations. I think your observation about the breadth of the work here being beyond the scope of any single committee is accurate. So I guess off the top of my head, my first thought is let's get these updates in the whole task force. And if we start to segment some of the work that you're doing in a way that might more productively engage the committees themselves, we can burrow down to that level of working together as that becomes apparent.
Great.
Other questions for Anne? Okay.
Stephen, if I can step in for one moment.
Pardon me, Jill?
If I can step in for one moment.
Yes, please.
The panelists have been joined by someone on phone with the last 4 digits 340. If you could please unmute yourself by pressing *6 and let us know who you are, that would be appreciated. Thank you.
It's Moonwater. Hi, folks. I'm just trying to participate as best I can this morning. My apologies for being late.
Thank you, Moonwater. I'll rename you accordingly.
Thanks.
Anne and Jill, can you circulate connection information, I'll say, for the presentations you're about to make to the City Council and the County Council in case any members of the task force want to listen in on those?
Happy to do that.
Yes, we can do that.
Thank you. Other discussion or other questions for Anne on the crisis response expansion planning process?
You know, I think I just want to throw out a disclaimer there. In hearing from some folks today, the health department, as you know, is dealing with a pandemic. And we've also been doing a lot of extra work in a very, very fast-paced time frame to get services and support out into the community relative to the pandemic with the CARES Act. And so our launch of this effort, I think, has been a little bit less let's see, expert relative to some of our other efforts in the past. And I just want you to know that for another month or so, it's still going to be incredibly crazy for us, and that we will do our best to sound cogent and organized whenever we talk. But really, life is incredibly crazy, and there are not 24 hours a day isn't enough. And I was just so excited to have an extra hour yesterday.
Stephen, this is Mike, if I might make a quick comment.
Yes, please, Mike.
And I work a lot with your staff, so I get to see some of that work that they do, which is absolutely amazing. And just an offer of help, if it can be useful, somebody else to take notes of some of your meetings or do something, please do consider this an offer of assistance. It's really important work. And I know sometimes you just need some more hands around the table. If that's useful, please reach out. If it's not, duly noted, and that's okay too, because sometimes too many cooks in the kitchen and you don't get a good meal. But I just want to offer that that assistance, and I think this is really important. You can tell by the level of questions and interest at this group. So if there is something that I can do on behalf of Opportunity Council or myself to help that process, please do reach out. Thank
you
you.
very much, Michael.
Anyone else? All right. Thank you very much, Ann. Next item on the agenda is the updates by local jurisdictions on jail diversion programs. Sheriff Elfo, are you still on?
I am.
Anything to report?
No.
Okay. Jill, I can't see. Is Travis on?
No.
Okay. Raylene, you're on.
It looks like Raylene has left as well.
Oh, okay. Darlene, are you still on?
I am. I'm still here. Basically, we just presented an overview to the city council, updating them with where we are on the programs for our bracelets. Since we began our program, we've had over 1,400 defendants serve their sentences on ankle bracelets for a total of 23,931 days. So those are all days that would have been spent in jail, but instead have been served through the electronic bracelet program. And we have had a 95% completion rate. So we're pretty excited about that. We are still using the Scram bracelet, and that is for alcohol monitoring, in lieu of having people report to probation daily or several times a week to do urinalysis. We use the bracelet instead. And that has been very helpful for people with their jobs and education and so forth, or leaving home. And especially during COVID, it's been really helpful because people don't have to come in. It lessens the appointments that they have to come in for. So we're very excited. We love this program. It's working well. The agency that we're using, Friendship Diversion Services, which is a nonprofit, does most of our managing for it. We just simply oversee it, but it's been great. As far as the court, we are still not open to the public. However, we are doing all of our hearings. All hearings are being done telephonically, and we're just at the point where we're going to be starting jury trials. We just have been able to hook up web access through our website. And so the public can, should very shortly be able to go to our website, and it's a very simple process, and you'd be able to watch any hearing or jury trial that we have going. So that is pretty much it for the city.
Thank you, Darlene. Can I ask you as a favor to forward to Jill the report you were referencing
Sure.
for dissemination to the task force?
Sure, be happy to.
Thank you. That's really encouraging news. Any questions for Darlene? Anybody else have information to provide on local jail diversion programs? All right. We're to the topic of other business. Is there any other business?
Barry has his hand raised.
Barry?
Oh, I was just curious if Eric could do just a quick summary of what rolled out last week. I was unable to go to that public rollout because of a council meeting. If you could just kind of summarize that, that would be awesome.
I think that's a great idea, and I was actually going to ask Eric or Heather perhaps if there's a recording and a link that they could send to the task force as well. I thought that was an informative hour.
So there is a recording, and I'll just give everybody just a quick summary because I think a lot of folks were present for that. For those of you who were not there, Heather and Lisa McShane moderated a program for a number of us to speak about the LEAD program. And the LEAD program, as you know, is law enforcement assisted diversion. And we've kicked it off, and it's a program that's up and running. We have 9 people that are participating in the program at this point, and we have I think we have 3 people that have been hired already, and we have 2 more in the that will be hired very shortly. Things are moving along very well. The program is for LEAD is running under Grace, and Melora Christensen is the manager from CMAR. And anyway, things are looking really good. We explained the program. We spent an hour. We had 65 people from the community, all stakeholders, watching for an hour, and I think it was very well thought of. It was a nice presentation, and we're happy with the results.
Thanks, Eric. Boy, I appreciate that.
Any questions? Maya Lisa.
I was very interested to hear about Darlene's discussion of how friendship diversion is used in the Bellingham Municipal Court. I don't believe it's utilized much in our district court. Can anyone speak to that? I don't know, Eric, if you can, or if there's anyone who could talk about why we don't use that more.
So I think it's probably a better question for Bruce in district court. I know that he has been working pretty extensively with bracelets and management for people on probation and as well as work release. And I think that he could probably answer questions a lot better than any of us.
Hi, Lisa. Bruce is often at the legal and justice systems meetings as well. Maybe that's a question that we can take up next week at the joint meeting.
Yeah, if I get Darlene's report, I will use it to craft an email.
Great.
To Bruce. Thank you.
Thank you. Other comments or questions? Other business?
Darlene?
Steve and I did. This is Darlene.
Yes.
I was just going to ask Eric, is your presentation on the county website? I did not get a chance to see that, and I'd really like to hear your presentation on LEAD.
Great, I appreciate your interest. I can tell you that we are putting it up on the prosecutor website. I'm not sure about the county website.
Can you get a link to Jill Nixon, Eric?
I'm sure we can. We'll get that done.
Great, thank you.
Stephen, this is Mike. I was just going to add one update on diversion programs.
Please, Mike.
Okay, sorry I didn't chime in. I was a little slow. I wasn't sure if my boss Greg Winter was on the call. As part of the diversion network or the continuum of care, Opportunity Council is fast and furiously as we can, as COVID will allow our contractors, working on a recovery house. So just to update that group, that we have hit some snags and some slowdowns during COVID, but we are looking for a springtime opening of that recovery house. Just to refresh this group's memory, drug court participants, mental health court participants, this will be housing with 24/7 supportive services for folks that have co-occurring disorders to be able to be. So I just wanted to update folks on, it's kind of a divert to, like where do people go when they're diverted from our system. So we're pleased that is continuing. Our clinical partner, Lifeline Connections, has hired a director for that. So progress is happening. And if you drive by Girard Street, you should see it taking place in some panels on the roof. So we are making good progress. It's not opening in the fall, unfortunately, but we are looking for a spring 2021.
Thank you, Mike.
Heather Flaherty's hand is raised.
Heather, please.
Can you hear me okay? Okay, this is the other business agenda item, right? So we're able to share updates about anything. Tell me if I'm wrong about that.
No.
Okay. On behalf of the Chuckanut Health Foundation, I know I'm not here representing the foundation, but I want to share just a brief update on the Racial Equity Commission development as it relates to some of the work the Incarceration Task Force is doing. And I think there will be some great intersections with the GARE Racial Equity Toolkit and looking at racial disparities in our criminal justice system. So a couple brief updates. There's a core team that's been working on this. Sue Ling Zhao and Christina Michelle, Councilmember Buchanan has been a part of this team, Prosecutor Ritchie, and this idea, of course, came out of a listening session that Prosecutor Ritchie had over the summer. And my understanding is that County Executive Sadoo and Mayor Fleetwood have both announced that they are going to make this a priority next year. I think they're working on creating a task force so we can expand the team that will be working on the details of what this commission's scope will be, where it will be housed, and kind of those nuts and bolts. So I just want to share that with everyone here because I think some of you are probably interested in that work, and I want to make sure that you're aware of it, that you're invited to it, that it's still in its really emerging phases. So there's lots of opportunity to make an impact on that work and to contribute to it. So more to come. And for those of you who are interested, I'll keep you updated as we go, as will the county exec and the mayor and Barry and Eric. I'm sure we'll keep everyone updated as well.
Great. Thank you for that report, Heather. That is extremely relevant to our work. Anyone else? Okay, I think we're at the point of public comment. Jill, are there any members of the public?
If anyone from the public would like to speak, please virtually raise your hand now by pressing the raise hand icon or *9 on your phone. And no hands are raised.
Oh, sorry, folks, this is Moonwater. Is there an opportunity for me to do a quick update as well?
Yes, definitely. Go ahead, Moonwater.
Okay. I just briefly wanted to acknowledge to this committee, I think that folks are aware, but that the Safe Spaces program is up and running at the Dispute Resolution Center. And this is a project that's been in formation for a few years' time. We had a soft rollout in June, and now we're trying to do more intensive outreach. And so this is a project that was born out of conversations over a several year span time with community members, city council members, and city administration in order to create a pathway intended for marginalized community members who felt unable or unwilling or previously unsuccessful in approaching the city with concerns about either their interaction with staff at the city or their interaction within the city of Bellingham, specifically to create a pathway for folks who may have been having experiences as a result of them being a marginalized community member. And so there have been comments and social media posts and sort of word floating around about experiences that people were having as they didn't feel safe bringing to directly to the police department or directly to other departments within the city. And so at the center, we have a confidential intake process set up, and folks are able to call or email the Dispute Resolution Center, and specifically the Safe Spaces program and our program coordinator, Britt Soloteski, and participate in a confidential intake process and then determine whether or not they want to remain anonymous or to share their information and the scope and nature of the experience that they had. And then we're working directly with the city to elevate those concerns and complaints to support the city to be able to be responsive and also to have a better understanding of the kinds of experiences that folks are having in the community in order to look for trends or patterns and to be able to adjust either city responsiveness or for us as a community to better understand the kinds of experiences that BIPOC members of the community may be experiencing. So please help spread that word. There's information specifically up on our website. We've got some, we have e-posters circulating. We have some hard copy posters that are going up as well. And we're also in the process of setting up outreach presentations to various groups throughout the city of Bellingham. And so if you're aware of a group who serves marginalized community members and BIPOC community members in particular, please let me know and I can connect you with our program coordinator, because we would love to be able to present about this program and help the public at large better understand its availability. Thanks,
Moon
everyone.
Will there be a time when you'll be able to report to us, not anything specifics, but in general, what are the experiences of people? What are they reporting?
That's part of the intent of the program, is to be able to gather and document information and to be able to share that transparently with the city. And so we're working with the city now to develop what that template is going to look like for reporting. And I think that this will take some time, both for folks to build trust in using this program and also to become aware of it. So I envision it being something, we're in the pilot phase right now, and I envision it being something that's going to evolve over time. And so it will take some time for us to be able to compile that information, but we have received calls so far, and as the next couple of quarters unfold, we'll be able to report more on those trends and patterns that we're seeing. So absolutely, we can make that available.
Any other questions for Moonwater? Thank you for that report, Moonwater. Jill, are there any members of the public on the call?
Yes, we have 7 attendees. No one has their hand raised.
Okay. Well, Jack's going to be very proud of me and us ending so early, but I will adjourn the meeting of the task force and look forward to seeing you all at the next committee meeting or the next task force meeting. Thank you.
See you later, everybody.
Take care.